We're Elemental and we are really excited about being part of TEDxStormont Summer Camp. We are a tech for good company based in Derry but operating throughout England, Scotland, Ireland and Wales. Elemental is all around connecting people, and so is TEDx when you think about it. So we were delighted when we were approached to be part of it, and we didn't have to even reconsider at all. It was an immediate response that we said, yeah, we'd like to support that.
Social prescribing, in its simplest terms, is around connecting people and their own communities to programs, services and events that are on their own doorstep.
What's really special about social prescribing is that it's a more than medicine approach to health and well-being. A lot of GPs are using social prescribing now to better support their patients. And what happens is that they will make a social prescription in the same way that they would make a medical prescription. They're now making a social prescription for their patients. And what that does, it connects their patient with what's known as a link worker in the community. And the link worker has a lot of time to sit down with the patient, find out what's important to them, what they're interested in, and help them navigate and find out what's available in their own community.
During this pandemic, what we've really learned is that it's confirmed what we've always already known, is that community needs to be at the heart of everything. They better connect up everyone in the community. We had seen throughout COVID that the community really stepped up to the plate, helped our most isolated, our most vulnerable in our community. So it's, rather than learn something, it's confirmed what we've already known. Working as community development workers for over 13 years each, it's confirmed that.
I suppose we would probably both admit that we knew that Elemental had an important role to play in that, but we probably didn't really realise how important the role was, because a lot of people are relying on paper, they're relying on working in an environment where they're with other people, but remote working is so important and they need technology to be able to do that. What we also learned was the importance of the social prescribing link worker. So this is I suppose it's a new role of recently. It's been around for years, and that it's a community development worker, but it's been given this term link worker, and it's been supported by the NHS long-term plan, and there's link workers being funded throughout the UK. But it really proved the importance of their role in supporting communities as well, because they are the people who are based in the community. They are the people who understand people's needs, and you know, for many people, handing someone a leaflet and saying, look, that's what you need to do and that's the support that you need to get, it doesn't work for everyone, and some people need more than that. So some of the stories that we've learned throughout COVID in terms of the connections that have been made and how people have been supported, it's really, I suppose it's touched our hearts to hear that we have had a part to play in that. So for anyone that's been affected by COVID, I suppose the most important thing would be to find out what's available in your local community, because sometimes you wouldn't realise that there's maybe a group or there's a session happening or there's an organisation that's there to help you. And I suppose that's what social prescribing and our core values are all about, but it's really about, you know, finding out what's out there. There's a lot of stuff happening online, obviously. There is an issue in terms of having access to Wi-Fi and iPads and things, so people talk about a digital poverty side of things, so that's another issue in itself. But if you can access, I helped with my mum and my mother-in-law. I got the iPad ready, I got maths on there, I got yoga, got armchair aerobics. I was down with my mother-in-law yesterday showing her some armchair aerobics and neck exercises that she could access just on her tablet. But I suppose we're conscious that not everybody has access to that type of stuff.
Maybe people might have that good family support around them as well. Maybe their family live in another city. There is strong community connections out there, so do reach out and don't be afraid to ask for help. As Jennifer says about the digital divide, if you don't have a smartphone, if you don't have an iPad, a tablet, etc., the community groups are helping and they're loaning you the tablets, helping you get set up online, helping you to find out if you can get the Wi-Fi, etc., and they'll help you with all that. So do reach out and don't be afraid to reach out.
And you know, ask as well, is there a local link worker program programme? Is there a local social prescribing programme in your area? So in a lot of GP practices now, they have like workers in the community and voluntary sector, they have social prescribing like workers and programmes available as well. So find out if that's available. But yeah, just really chat to someone, even if it's a neighbour, and find out what support they're getting, because coming together is the way that we're going to really tackle this. And as well, if someone is seeing someone who's maybe hasn't opened their curtains in a few days or hasn't been engaging with anyone, you know, knock on the door and see if they're okay, and really look out for each other. I suppose it's what COVID has proved more than ever, the importance of looking out for each other.